We absolutely hope that you are enjoying yourself this Tuesday morning on Y in the Morning. This is your favorite channel, Y254. My name is Shiko Kaitani, part of the morning crew that comes your way every weekday from 7 a.m. till 10 a.m. We hope that you also enjoyed that particular discussion with Collins Masinde on our entrepreneurship and career segment this Tuesday morning. Remember, you can get in touch with us through the numbers that are on your screen. Of course, we do have our WhatsApp line that's active. We'll be sampling some of your text messages at the end of the show. Not to mention our SMS line is 22162. Please tell us where you're watching from, and of course, please include your name. Now, as you already know, it is Breast Cancer Awareness Month, and even as we get to the final part of the show, we actually want to start that conversation right here on Y254. So here to tell us more, and even just to shed some light rather on what the government is up to this month, is Dr. Catherine Nyongesa from the Texas Cancer Center, who is also, can I say, more or less part of the Kenyatta National Hospital as well, who is, can I say, counseling?
Cancer specialist.
Cancer specialist, okay. Also from Kenyatta National Hospital. Thank you so much for being with us, yeah?
Yes.
Now, what are some of the misconceptions, Daktari, that we have as young people about breast cancer?
One is that, okay, breast cancer is not really a big problem in the young generation.
Right.
But we want them to be aware because of their parents, the mothers, the aunties, you know, the big sisters, their fathers too, because breast cancer can occur in men. But we do get a lot of breast swellings in young women and young girls, and they always panic. They think they have cancer. And most of the time, this could be what we call fibroadenomas, and really is nothing to worry about. Majority of them wear off with the time. And then we also see adolescent boys, when they are growing up, because of the hormonal changes, they find the breast swelling. And you'll see a mother panicking, running to hospital, saying, "Ma, I think my son has cancer because he has this lump in the breast." So we call that breast hypertrophy or gynecomastia, and it's just a normal part of growing. And as these boys grow, those lumps will disappear. We worry more, especially when you are a man and maybe above 30, you are getting lumps, or you are a woman above 40, you are getting these lumps that don't go away. Then that is some cause for alarm.
You know, Daktari, I know for the longest time, people have always just thought that, by the way, this is just something that affects women.
True, because we actually know 99% of cancer, of breast cancer, occur in women. Only 1% is occurring in men.
Right, right, okay. And so why is it so important for young people now to start knowing about the dangers, or just knowing about cancer in general? Because they always think, it's something I can worry about when I'm in my 40s. We want them to be more aware, because they are the future generation. They're the ones who are going to take our country to the next level. So when they're aware, one, they'll get interested even in training, gaining education about cancer, so they can take care of our ailing population. And number two, also for them, once they are aware that actually cancer exists, then they'll create this culture of early screening, early checkup, so that in case cancer is picked up, it's picked in a very early stage and in a curable condition. And also for them to be aware of the normal anatomy of our body, and if there are any changes, really to express them, and also be aware of some unusual changes, like in the breast, those lumps which I mentioned before, that are not necessarily cancerous. In fact, 80% of the lumps that people feel in their breasts are not cancerous. It's only a small percentage. And that small percentage, the only way you will establish is cancer, it's by going for a biopsy, or a small piece of tissue is taken to the lab to confirm. Okay. All right. So being a specialist with Kenyatta KNH, right? Maybe you can tell us about some of the statistics and the challenges that the government is facing towards cancer treatment in Kenya. So tell us more about that.
Yeah. In our country, we see more than 40,000 new cancer cases in general. And surprisingly, we lose over 28,000 of this. So it is quite a big burden, and most of the cancer patients come quite late, and you'll find the treatment is expensive, and 80% of these patients will need radiotherapy, for example. And as Kenyatta National Hospital, they have put in place the cancer machines to treat patients. And we also know the private fraternity, including Texas Cancer Center, have also put up machines to take care of these patients.
Yes.
But the biggest challenge is that the resources are not enough, and also the cost of the treatment. Most of the common people are not able to afford. And now with the devolution of healthcare, the government has made very major plans to train doctors for the different counties. And even in future to put up cancer centers in strategic locations, to spread out throughout the country. And I'm also aware the cancer screening equipment, though they had a lot of controversies, but the government had a goodwill of trying to put these facilities close to the common mwananchi, so that you feel a lump in the breast, you go, you get a mammogram, for example, or an X-ray or a CT scan or an MRI, just to check.
Okay. All right. So we want to remind our viewers, if you're watching this program and of course you have stories to share with us, or if you'd like to contribute to this discussion, you're more than welcome to do so through our social media platforms, not to mention the SMS numbers that are at the bottom of your screen. We will be sampling your questions, especially if you do have questions for Daktari today. Please do so. Get texting right about now. But so, Dr. Catherine, you've talked about devolution and of course treatment coming down to the county level. What exactly is also the government doing to make it more affordable? Because like you had said, that people tend to shy away from even bothering about healthcare because they say, you know what, it's not something I can afford. Let me go to my herbalist. Let me, you know.
I will tell the common mwananchi and even the youth watching, if they have parents ailing with cancer, they shouldn't shy away from treatment. The government is moving towards universal health care. And of a big example is the National Hospital Insurance. NHIF.
Right. So people, we need to start taking NHIF very seriously.
Definitely, because I've known, like in the past 1 year, NHIF has assisted so many patients access treatment at affordable costs, because the card can pay for quite a significant amount. And this has eased the burden to the families. So when they have to top up, it's not a lot of money than if they didn't have the NHIF card. So I would really appreciate the government for this move. And more needs to be done so that people don't waste money on herbalists or alternative medicine, because by the time they come back now to hospitals, the cancer has already spread and even gone to very advanced stages.
So things now have escalated, and now you have a bigger issue to deal with.
And more expensive.
And so I like that you brought up the NHIF situation, because for as little as 500 bob, you can be contributing towards your health. Your health care, that is.
True.
Okay. All right. So now let's talk about the warning signs about cancer. What are some of the warning signs that we need to look out for?
Okay, first maybe let's focus on breast, because this is a breast cancer awareness month.
Breast cancer.
One is supposed to be the best doctor of your body. So you feel your breast, you feel for any lumps, any skin changes, any pain, any nipple discharge. If the nipple retracts inside, you should be maybe alarmed. The other thing is, in general, for example, you may have a sore throat that is not going away. You could be having throat cancer. the young people, I see them a lot with the what we call cancer of the nasopharynx. It's a throat cancer where it presents with lymph nodes, amangae, in the neck. You just feel some swellings. You are treated for a throat infection. It doesn't go away. It's good to have it checked. Sometimes they present with blocked nose that doesn't go away. You are treated for sinuses. Hey, you are not improving. You're having some headaches that are not going away. You're having a swelling in any part of the body that is just growing despite the treatment, or you're having repeated infections that cannot be explained despite antibiotics, and unexplained weight loss. You're just wasting away. Something needs to be done and probably rule out cancer.
I know even every year as we get into the Breast Cancer Awareness Month, one of the things that specialists really encourage the public to do is actually self-checks. So please explain what a self-check is before we get Val on set. She's going to actually be our model today, or demonstrating for us, you know, with, of course, your guidance as to how to go about a self-check. And I think it's important for young people for us who are young people to even know how to do a self-check.
True. One is for example, let's start with the breast. You should not be poking your breast, you know, with fingers. You poke inside to feel for lumps. You go with the flat palm and try to go through the whole surface of the breasts. You also lift up your arm, feel your armpits, and check for any lymph nodes. And also you stand in front of the mirror, look for any skin changes, nipple retraction. As you touch also, is there pain? Is there a lump that you are feeling? The size of the breasts. One should not be alarmed because our breasts are not exactly symmetrical. They're not the same.
This is the thing. Interesting fact to know about the human anatomy is that we are actually not symmetrical. Like one side is bigger.
True. So if you find one breast is bigger than the other one, don't start crying that maybe one has cancer, the big one. No, it's not true.
All right, so let's call Val on set. Hey, Val. So Val is going to be our model today. So I'm at home, I'm watching, and I'm thinking, okay, fine, today I actually want to do that self-check. So what's step one, like you had said?
Number one is we prefer, for example, if you are getting regular periods, you choose a day in the month, like the 10th day of the month, that you dedicate for self-breast check. The best place to do it is in the bathroom. You've been undressed, and then you can, and you have privacy, you can examine yourself. You can also request your boyfriend, your husband to do the self-check for you. And women should not hide like from their men when they have lumps in the breast and you don't show your husband. You know, because I've seen some women coming really late with breast cancer. Then you ask the husband, you didn't realize this woman had this lump that has been growing. Says no, she's been hiding. So having said that, now let's go to the basics. So first, in front of the mirror, look at the symmetry. If it's usually one is bigger than the other, you shouldn't worry. But if you see one is growing much more than the normal situation, then you should be alarmed. Then secondly, with the flat part of your hand.
So this is here?
The palm. The palm, start palpating your breast through all the quadrants. Do you feel anything? Do you feel pain? Any lumps? Perfect. So you feel throughout the whole breast.
The top, the bottom, side.
A circular movement. Because our breasts are circular. So go all the way. Feel. Don't poke, because if you poke, you know, our breast is not like, it's not a balloon. It has fat, it has muscle, it has glands. So it is normal. If you poke, you'll feel the normal breast tissue. So don't worry. But if you feel a discrete lump, then there's cause for alarm. Then you also feel the
lymph nodes.
For lymph nodes,
which are found where? At the base of your neck?
Around the collarbone, just above and below. And in the armpit.
So if you do feel something, and how should a lump actually feel? Is it really hard?
No. Most lumps are actually, they are painless.
Yes.
And they are just not hard, but they are discrete. You'll feel that this is separate from my breast tissue.
Yes.
Yeah.
Okay. All right. Well, thank you, model. I know Mr. Barry Moses was very excited to assist in this examination, but remember, they should only be your spouse or your partner, your boyfriend, like she said. Dr. Let's be very clear on that. Do not accept assistance from anyone.
Or the doctor or the nurse.
That's true. Thank you, Kalabival. Very brave for doing that on TV, by the way. But now, that being said, let's talk about, before now we get to how people can access this information and even where they can go for checkups. Tell me, is one of the causes about, for acquiring cancer rather, nutrition?
Nutrition does contribute, but to a very small extent.
Yes.
What we say about nutrition is the weight.
Yeah.
Yeah. We should try to avoid overweight. When you're obese, you are prone to, apart from cancer, you are prone to lifestyle diseases like diabetes, hypertension, which are not good
because
diseases.
There are these debates, even when you watch online, a lot of specialists say, or even doctors say, that if you just eat right, chances are you will not get cancer.
I think it's a myth. It's controversial. Yeah, it's controversial. Then the other risk factors, for example, is tobacco use.
Yes.
Yeah, excessive use of alcohol, excessive exposure to the sun. Yeah, without using sun protection like sunscreens.
Yes.
And majority of the cancers are genetic, so you can't do anything about them. You can't prevent them.
Yes.
And unfortunately, like for women, breast cancer, being a breast cancer month, we find that breast cancer, one of the risk factors is being a woman.
Yes.
You have a higher chance.
Yes.
Having a breast, you have a higher chance.
You're right.
So you cannot prevent. And for example, so women are encouraged to breastfeed their children, get their first baby before age 30. So you finish your college, university, and then now you are ready to get your baby. Don't wait until now you are over 30, then you are starting your first baby.
Right.
You are at a higher risk.
Really?
Yeah.
Oh, wow. Okay. I can see a text message that has come in through 22162 that says, I know we're discussing breast cancer awareness, but what about prostate cancer? Because the gentlemen are actually very, very concerned about that. And I want to say a big thank you to Mike, who's tuned in from Kitale.
Okay. So prostate cancer is also quite common in our society, but the youth should not worry.
Yes.
Because we rarely find prostate cancer below the age of 40.
Okay.
Yeah, but of course, this is a generation which is assisting aging parents.
Yes.
And you see your dad, maybe at night he tells you, son, take me to the toilet like 2-3 times. You should something is not right.
Yes.
Or you go to pee and then your dad's urine stream is very poor. Most of the time the urine is there, the guys are standing here and they're able to reach.
Yes.
But you find he has to move very close to the urinal. Then a poor urine stream is not good.
Yes.
Or he has symptoms of urinary tract infection, going to the toilet often, having pain on passing urine. Or he goes to pass urine and then he feels he didn't finish. Within a short time you want to go back.
Right.
Yeah, it's called incomplete voiding. Okay. So those are symptoms of either a big prostate, we call it BPH, which is not cancerous, or there could actually be symptoms of prostate cancer. Okay. And the only way you will establish is by having a test.
Okay. All right, so Dr. please tell us, how different is this year's breast cancer awareness campaign from all the other years? What's going to be new this year? Have you introduced anything, even as the government? Okay,
this year campaign has been slowed down, especially because of what's happening in the elections and people's mind are to elections. But cancer survivors in a small way, and even hospitals and organizations have been coming together. And one of the theme is Sober Up for Cancer.
Yes.
So it's a month, October, that we all need to sober up and think about cancer and go for screening so that cancer is picked up early. Yes. It's also a month for what they call care to limbo, where people can dance below the limbo without touching it, as a way of creating awareness and even raising funds to support the poor patients who cannot afford, the poor patients who don't even have money to pay for NHIF. You know, 500 bob a day, it's not easy money for majority of our households.
It's very true. It's very
so
true.
Those are things, and one can say, this month I will not take beer, I'll just save up a little bit and support this cancer patient.
So we can all do something. We can sacrifice something this month and actually, all right. So now, where exactly can I go for my screening in the event that I'm not really comfortable doing my self-check? That's number one. And how can we generally, because I know there's going to be so many posts where people can stop by, different posts across the country and even on county level. But maybe you can give us a brief as to where we can go for our checkup, our screenings, even as we wrap up.
Yeah, screening can occur even in the county hospitals. You don't have to come to Nairobi for screening. Visit your nurse, visit your nearest clinical officer, your doctor, ask them, can you assist me? I want to be checked. Or I have these symptoms that are not going away, and I'm seeking a second opinion. One is free to do that. Those who are in Nairobi can actually report to the major hospitals, Kenyatta, the private hospitals. You can also even report to Texas Cancer Center and tell the doctor, I want to be screened for cancer. So people should not shy away. And going for screening doesn't mean that you'll be found with cancer. It's really just a way of check. And once the doctor checks you and tells you you're okay, you now have to worry about next year or sometime there.
Okay, then, so is it free this month?
Okay, I wouldn't say it is free, but I'm sure in the county referral hospitals it should be free, or if you have an NHIF card. In the private institutions, you may have to pay a small fee. And then even, you know, screening doesn't just mean being examined. You may be referred for some tests, which attract a cost. But it's manageable. It's not expensive.
I know Mr. Barry Moses is on set to take a look at some of your text messages that are coming through, but I also do have one here for you, Daktari, and this one has come in from Leila right here in Nairobi, who says, hello Daktari, thank you so much for the great information. One thing I would like to ask is, should I be worried if breast cancer has been in my family for generations?
True. The biggest example is Angelina Jolie. Angelina, she knew her mom had breast cancer, and she had to go for screening at an early age, and she was told your risks are so high. And because these risks are so high, you have to go for a prophylactic mastectomy. So Angelina had to go for a prophylactic mastectomy, which means you remove all your breasts. And then have artificial reconstruction, so that you have artificial breasts. But that is one thing that can be done. So what we've known, that if there's a strong family history of breast cancer, you are at a higher risk of getting breast cancer. But you don't have to chop off your breasts like Angelina did. Because maybe you are still young, you want to have children and all that, you want to have a family. So you can wait to have a desired family, then go for surgery, or you just go for regular screening. And in case the cancer is picked, it can be picked in very early stages and it can be cured. We have another question here that's come in from Rachel Asantisana, watching us from Kisumu. We are so glad that you are enjoying the show. This is a very good question for you, Dr. Catherine. How many times in a year should one actually go for checkups? Generally your doctor will tell you how regular you should, but majority of the people will recommend at least once a year. And if for the first few years, if the doctor finds your risk is so low, you may actually skip even a year and go the year after. But also, in case you notice anything abnormal in your body, then you don't wait for next year. Just go immediately for screening. All right. We've got any other alternatives other than self-check and actually going for screening? This one is from Janet. I know majority of our population, no one goes for screening.
Yes.
So if you opt not to go to hospital,
yes,
then you have to really check yourself. It's still allowed that you check yourself. And if you notice anything unusual, you go. Because, you know, we only have one life and one body.
Yes.
So it is something that we should take personal. It's a personal responsibility that we should be responsible for our own health.
Okay, let me take a look at another one that's come here from Philip, who's brought up the issue of nutrition, Daktari, and says, okay, so you talked about, of course, it being a myth that it's not necessarily nutrition that determines whether or not we are going to get cancer or breast cancer, whatever kind of cancer it is. But is there something in terms of diet that we can do? What would you recommend?
I would recommend a balanced diet.
Yes.
Anything you eat to moderation.
Okay.
Yeah. For example, we'll ask you about meat. Should I eat meat, not eat? Should I drink milk, not drink? Really, you can eat anything, but to moderation. And you know, diet is so diverse in the African community.
It's true.
If you come to Western, for example, if my dad has not eaten ugali, he has not eaten food.
He also food.
You go to maybe to Central, there's mokimo, you know. If somebody has not eaten mokimo, then it's not food. So we cannot really recommend a special diet, especially in a country with diverse community and diverse nutritional needs.
Okay. Yeah. All right. A question here that has come in, I can see from Jackson. Thank you very much for your contribution to the show. Jackson feels very compelled and is very touched about what you said concerning how the government, or even what you guys are doing as an initiative to help those who cannot afford healthcare. And is probably asking, how can they contribute and where do they take their donation? For example, if someone who's watching wants to give up X amount per month, or even a meal or their lunch just to help a cancer patient, where can they donate this money to?
Okay, for example, at Texas Cancer Center, we have the Uwezo Cancer Support Group.
Okay.
So they can meet us through Facebook, and then we connect them to the Uwezo Cancer Support Group leader.
Yes.
And this is a group of cancer survivors who are coming together, trying to encourage one another and even assist the needy people in the community to cope through this cancer. And also in government hospitals, I'm sure even at Kenyatta, one can report to the cancer unit and say, I'm willing to help. How do I go about it? He will be guided through the public relations office. Yeah, they do accept donation. And in the county hospitals, there are mechanism of how people can accept. And also, once they reach those hospitals, the hospitals can help them identify the needy patients who actually have cancer and they are not able to pay the 500 fee monthly for NHIF, so they can also assist there.
Okay. All right. Mr. Barry Moses is on set and is ready to sample some of your text messages that are coming through our WhatsApp number. Barry Moses, karibu sana.
Yes, thank you very much, Chico, and thank you very much, Daktari, for coming through. And I go by the name of Barry Moses, or It's Barry Mo on every social media platform, and I'll be taking you through social media. And straight to our first question. Hello, this is from Lydia. Lydia wants to know if constant UTI can cause cancer, Daktari.
No, it's a myth.
All right, some people might not know what UTI is, so you can take that.
Okay, it's a urinary tract infection. So sometimes if you have constant urinary tract infection, it could just be an infection and you need to go to the doctor. They do a urine culture to confirm if it's an infection. Though we know that some cancers can mimic a urinary tract infection or a UTI, like for cervical cancer. A woman will just keep on having a discharge. They are treated for UTI and it doesn't go away. So in case of that, then one has to be done a pap test or a pap smear to confirm if it is cancer or not cancer. But most UTIs are treatable and it's not cancerous.
Thank you very much, Dr. The next one is, what happens if your lover likes to suckle on your breast? Does it reduce the chances of getting cancer? This is a viewer. She didn't leave her name and where she's watching us from, but we appreciate the question.
Yes, we do.
Yeah, it's a good question.
Yes.
Yeah, really suckling of the nipple is more for pleasure, and it doesn't predispose or increase the risk of your spouse getting cancer.
Okay.
All right, and it doesn't reduce the chances.
It doesn't reduce the chances.
All right.
Yeah.
Like Terry made so many.
I think we'd all be doing that if it reduced the chances, right?
She already made
What reduces the chances is when the baby breastfeeding milk, you know,
yes.
children breastfeeding.
Children breastfeeding.
Yeah.
That helps to reduce.
Yeah, it reduces the risk.
All right, you already made us look forward to the 10th day of the cycle, though. Right? How can we control the spread of cancer? This is Felix Kipkirui from Naivasha, and is loving the show. Thank you very much, Felix.
Yeah, okay. You cannot prevent the spread of the cancer, but you can create awareness the way we are doing now, so that people are more aware. And in case cancer occurs by bad luck, it can be picked in an early stage, which is treatable and curable.
All right, thank you very much, Dr. I think I'll pass the baton to Shiko, but before that, keep your views and your comments coming on our WhatsApp line 0700345 is our WhatsApp line, and our SMS line is 22162. And please remember to start your SMS with YM254, and don't forget to leave where you're watching us from and your name as well. Back to you, Shiko.
Absolutely. Okay, as Barry Moses said, we definitely are looking forward to your feedback, and we'll be sampling even more and responding to you in the course of the day. If you would like to catch this interview online, be sure to log on to our Y254 YouTube page for more information. Dr. Even as we wrap up, maybe some more information or contact details as to where they can reach you. Of course, you're more than willing to answer some questions. I think that you're a very funky, cool doctor. I mean, look at you in your boots and your nice dress. And
Thank you.
Yes.
Yeah, I'm sure now we have to interact. We can interact on Facebook.
Yes.
You can find us on Texas Cancer Center Facebook page. You can also find us on WhatsApp. The phone number is 0723698888 in case of an emergency. And you can also walk to our different branches. We have one in Eldoret. You can walk there for screening. You can also walk to the one in Mbagathi Road in Nairobi, in Madaraka, Texas Cancer Center for cancer screening, and even just more information on what is cancer, what causes it, how can one what are the symptoms. So those are things we are willing to engage. And we should not just wait for October. When October is over, we all forget about it. No, this is something that we need to continue preaching to our people. And as youth, when you see your dad or your mom is sickly, just take your parent to the doctor just to check that they don't have cancer.
Okay. All right. A big thank you to you yet again. That is Dr. Catherine Nyongesa from Texas Cancer Center, who is also a specialist from Kenyatta National Hospital. Thanks a lot for watching this particular episode of Y in the Morning. We'll see you tomorrow, bright and early.